Depression, or Major Depressive Disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. It leads to persistent feelings of sadness and loss of interest. The major types, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, include Major Depressive Disorder itself, which is the classic presentation. Persistent Depressive Disorder, also known as Dysthymia, is a chronic, low-grade depression lasting 2 years or more. Peripartum or postpartum onset occurs during pregnancy or within 4 weeks after delivery. Seasonal pattern involves episodes that occur at characteristic times of the year, such as fall or winter. Melancholic features describes a presentation with severe anhedonia and symptoms that are worse in the morning. Causes and risk factors are multifaceted. Neurobiological factors include dysregulation of neurotransmitters like serotonin, norepinephrine, and dopamine, reduced hippocampal volume, and hypothalamic pituitary adrenal axis dysfunction involving cortisol. Genetic factors show a heritability estimated between 40 and 50%. Environmental triggers include trauma, loss, chronic stress, and social isolation. Key symptoms require 5 or more to be present for at least 2 weeks and must include either a depressed mood or loss of interest. The symptoms are depressed mood most of the day, markedly diminished interest or pleasure, known as anhedonia, significant weight change or appetite disturbance, insomnia or hypersomnia, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or excessive guilt, diminished ability to think or concentrate, and recurrent thoughts of death or suicide. Diagnosis is based on a clinical interview using Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision criteria, where a thorough history is essential. Screening tools like the Patient Health Questionnaire 9 are used. A medical workup is necessary to rule out organic causes such as hypothyroidism, vitamin deficiencies, or chronic illness. Treatment involves several approaches. Psychotherapy is first line. Cognitive behavioral therapy is the gold standard for challenging negative thoughts. Interpersonal therapy focuses on social roles and relationships. Pharmacotherapy includes first-line selective serotonin reuptake inhibitors, such as escitalopram at 10 to 20 milligrams daily or sertraline at 50 to 200 milligrams daily. Second-line options include serotonin and norepinephrine reuptake inhibitors, like venlafaxine extended release at 75 to 225 milligrams daily, or duloxetine. Other medications are atypical antidepressants, for example bupropion extended release at 150 to 450 milligrams daily, or mirtazapine. Neuromodulation therapies include electroconvulsive therapy for severe, treatment-resistant, or psychotic depression, and transcranial magnetic stimulation as a non-invasive alternative. Complications of depression can include suicide, self-harm, substance use disorders, significant impairment in work, school, and relationships, and the worsening of other medical conditions. Prevention and management focus on building strong social support, regular physical activity, stress reduction and mindfulness, and adherence to treatment plans. If you are having thoughts of suicide, contact a crisis line, such as the 988 Suicide and Crisis Lifeline, or go to the nearest emergency room immediately. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.